Hello and welcome to Coronavirus Catch Up. I'm Jordan Kenny and we're live on the BBC News NI website and Facebook page and on the BBC iPlayer for the next 20 minutes or so. So thanks for tuning in, however you're joining us. If you're watching on Facebook, feel free to get involved in the conversation. If you have questions about what's being discussed, leave them in the comment section and we'll try our best to get to them before the programme finishes. In a few minutes, I'll be speaking to Dr. Eddie O'Neill from the StopCovidNI app. But first, today we saw an important milestone in the fight against coronavirus. Since we started covering the pandemic at the beginning of the year, we've been talking about one thing which we hope will be the solution: a vaccine. Today was the day that so many of us have been waiting for, the beginning of the vaccination rollout here in Northern Ireland. Our health correspondent, Mary-Louise Connolly, was right there as the first vaccine was given to Sister Joanna Sloan. She's a nurse who will be overseeing the rollout of the vaccination programme across Belfast. I spoke to Mary-Louise about the significance of this earlier today. Mary-Louise, you were at the Royal Victoria Hospital this morning where the first vaccine was administered. Tell me a bit about that.
It was indeed, Jordan, and it was a real privilege to be there to witness something so significant and so historic. We were brought in to a building that up until a few weeks ago had been a warehouse, quite an unassuming building, brought down a long corridor. And even at that stage at 7:30, nurses, mostly workers, had started to line up against the wall, waiting their turn after the first person, Sister Joanna Sloan, received her vaccine. So when we were brought into the room, the actual vaccine itself, the Pfizer vaccine, was brought out on a trolley. It was in a small box. It's a tiny vial containing this liquid of hope. And Sister Sloan rolled up her sleeve and, she was given the vaccine. It's quite a long needle, but I think the rest of us flinched and gave a sigh of relief when it was all done and it had all happened very, very smoothly. It was a poignant moment. We've waited for this for such a long time, and there it was, from Belgium to Belfast, within a matter of weeks the vaccine was there, and I think it really is the start of us turning a corner.
You've been covering the pandemic, Mary-Louise, for almost a year now. Just put into context how significant today was.
If you imagine that most vaccines, it takes up to 10 years for a vaccine to be manufactured. Now, only 10, 11 months ago, as you say, we were starting to talk about coronavirus. And at that stage, we were starting to learn about Wuhan, the place where there was the first case had been diagnosed. Then we started to learn about what the coronavirus was, all these different stages. And I remember back then talking to you, Jordan, saying, we are waiting now for a vaccine. The whole world is working towards this one objective. And here we are, 10 months later, within the same year, the vaccine was made, it was manufactured, then it was approved by the Medicines Regulatory Agency, and then it was delivered around the UK and, of course, importantly here to Northern Ireland, and that all happened really in a matter of 10 days. That the latter stage, it is hugely significant. I think back in March and April, people were telling us, we will be lucky if we get this before Easter. Now, that doesn't mean, according to the authorities, that this has been rushed through. According to them, that all the different hurdles were jumped. Every time there was a different stage, it had been approved. All the independent advisors were there. And this morning, everyone, including the Chief Medical Officer, they have all said that this vaccine is safe and we wouldn't have it if it wasn't otherwise. So it's hugely significant, Jordan. But really, it's only the start of a process. We have many, many more hurdles to jump and many, many more months to get through before we're really going to feel or experience a difference.
Well, you say that this is the first hurdle, Mary-Louise. Where do we go from here? What are the next few steps?
Well, I think on everyone's mind are those men and women, vulnerable people who are living in care homes. They have been at the centre of this from the word go. And this morning, while I was there, I was asking the Chief Medical Officer, also Patricia Donnelly, who is heading up the rollout of this programme across Northern Ireland. So those people that I filmed this morning and that I spoke to, including Sister Sloan, they will be vaccinators. They will possibly in the next 48 hours, be able to go out to the care home. So I think that is the next stage. And what we saw this morning, we couldn't film, there was a dummy run involving coaches, a large coach, which I imagine they're going to ferry the vaccinators about to the care homes. So there are 7 main centres across Northern Ireland. They'll be used as satellite points. The vaccinators will leave from each centre with the proper equipment, and then they will be transported to a care home nearby, and they will start vaccinating the residents and the care staff within that care home, and that's how it's going to be administered. And now that I've seen it happening this morning, it is doable. It takes maybe 2 people per person. There's a lot of paperwork, there's a lot of questions that have to be answered, and then the vaccine is administered.
So as you heard from Mary-Louise there, yes, it is good news. The vaccine is here, the rollout has started, but we're not entirely out of the woods just yet, and we still need to be adhering to the rules. So following social distancing, wearing our masks and limiting our contacts. Now, talking about contacts, contact tracing is a term we've all become familiar with in 2020. By now, if you've not had a close contact notification and had to isolate yourself, chances are you probably know someone who has. Thousands of us have downloaded the StopCovidNI app. But when we asked you to send in questions to Coronavirus Catch-Up, we realised there's a lot of people who still have questions about how it works and what it's actually doing. So here to answer those questions is Dr. Eddie O'Neill. He led the development of the StopCovidNI app. Hi Eddie, how are you?
Hi Jordan, I'm good.
Thanks for coming on. Before we get into the questions, Eddie, you're the product manager for the StopCovidNI app. Can you explain to us briefly just what that means? So what is your role?
In any project, there's always partnership and there's multiple people involved in a team, but every team has to have somebody on point who leads it. So my role was to coordinate the efforts of the private companies and public health officials and individuals that were involved from the Department of Health and from the Health Board and Public Health Agency and colleagues in BSO. So it was a big effort with many hands to the pump. So my role was just to coordinate, make sure it happened in a sensible manner and in a safe manner, and to make sure as well that we delivered something that the public would find acceptable.
Okay, well, we've had quite a few questions sent in about the app for you to answer. We'll try and rattle through as many of them as we can. The first question tonight, it's pretty simple. How does the StopCovidNI app work?
Okay, so the app it's a proximity app. So what it does is it uses the Bluetooth signal off your phone. It has it on a low energy setting so it doesn't drain your battery. And what it does is when you have 2 app users that come into close proximity to each other, the app exchanges anonymous ID keys between the 2 phones. And you can't see that on your phone. It's done in an anonymous way. And at the same time, it also tests the strength of the signal, and it works out if you've been closer than 2 meters or for a duration of longer than 15 minutes. And if it does register that that's happened, it stores that ID key and you go on about your business. If at any stage an app user tests positive, they get an SMS text out to them with an authorization code, which they can then upload into the app, and it tells other people who've been in close contact anonymously that they have been at risk of infection. They've been exposed to somebody at close proximity. They might be infected and they should self-isolate. It now tells them how long they should self-isolate for, and it tells them to get a test if they develop symptoms.
So you mentioned there it tells them how long to isolate for. Does that mean everyone who gets a notification, not everyone will be isolating for 14 days then? Is that the case?
That's the case, yeah. We had some feedback initially that people were concerned that they didn't know when a contact might have occurred and that they might be being asked to identify or to self-isolate longer than they needed to. So we worked with the developers and we updated the app to change that so that people then were getting specific information that was tailored to their own individual risk. So now you can get anywhere up to 14 days or a shorter period if your contact happened a longer time ago.
Okay, we've been talking about vaccines, as you heard already this evening. We've had this question sent in, and it asks, how will the app be used going forward with the vaccine? Do people who are vaccinated still need the app, and should they still isolate if they're pinged by it?
Okay, so probably you've seen a lot of the coverage about the vaccination today. So you don't get instant immunity whenever you're vaccinated. You need a second dose within 3 weeks of this particular vaccine. And for the other vaccines that are coming online, it may be that that dose interval between the two doses is slightly different. But once you've had your second dose of the vaccine, about a week later, you're probably likely to be immune. So at that stage, you could stop using the Proximity app. You could download, you could remove it from your phone, and there's instructions on how you could do that. But you shouldn't do that until you've definitely been vaccinated with the second dose and you've given enough of an interval. It may be that the advice will evolve in this area, and that maybe some people will be asked to get tests just to confirm that their vaccine has worked effectively for them. At this stage, this is evolving because it's a new situation we're in. So I think people will have to follow the advice, and we'll do our best with our media comms to try and help keep people informed. And obviously with the support of BBC and other outlets, we hope to keep people informed as to what exactly they should do. So I suppose just to try and keep it simple, you won't be immune with your first dose of the vaccine. You have to wait an interval for the vaccine to work after the second dose, roughly about a week. And after that stage, you shouldn't have any problems with the COVID infection. So you won't need a gap after that.
Okay, Eddie, we've had this one sent in on Facebook from Sinead just as we've been on. Sinead says her husband and her they both have the CovidNI app. He tested positive last Friday and updated his app with the code when he received it. It's now 4 days later and she hasn't had any notification on her app. How is that the case? And she's asking, how effective is it?
Well, the app's been really effective. Since it was launched, we've had over 28,000 exposure notifications delivered through the app. But we have a helpline set up and an email address account that has let us know that sometimes there are delays in people getting notifications. Usually it's because of things like the settings on your phone. So if you haven't had your Bluetooth on, it may not have registered proximity. Equally, if you have an aggressive battery saving mode set on your phone, sometimes it will not process the fact that you've had a close contact and that they've been positive until you actually actively turn the app on or activate it. So there's a whole number of reasons why it can fail to notify straight away. So I would suggest that she needs to maybe check the settings on her phone and make sure that she has those things addressed.
Okay, so keep an eye on those settings. Okay, by now we all know the rules of social distancing, 2 meters, face coverings, and there's perspex screens in a lot of places to keep us separated. This question asks whether or not the app takes into consideration these measures. So it knows how close we've been, but does it know, for instance, if we're wearing a mask or if we've been behind a screen?
No, and I think that's where we have been trying to educate people and send out information. So there's an NI Direct website that explains some of these things. Basically, because the app just checks the distance that you're away from another app user by the Bluetooth signal, it doesn't know if you're behind a perspex screen or if you're wearing PPE that would prevent the infection being spread. We've done a lot of work with employers and with schools and various groups to try and encourage people to use the pause tracing function if they're using PPE or if they're behind a screen. For instance, if you're working at a checkout in a supermarket, you're advised to pause the tracing function while you're being protected in that way so that it doesn't give a false positive reading. If people check on the home screen of the app, there is a pause tracing function there. It allows you to suspend the contact tracing function, and it sets a reminder for you to switch it back on so that if you're in a supermarket, if you're going to be going to a canteen or a communal area, that you remember to switch it back on when you're not being protected by protective measures.
So if the app hasn't taken into consideration, the PPE and those perspex screens, how seriously should we be taking those close contact, pings or notifications if we know we've been behind a screen, for instance?
Well, I think the trouble is that the app will tell you a date on which a contact occurred. So it could have occurred at any time in that 24-hour period if you were in contact with other people. So you can't really say specifically that it maybe happened because you were behind a perspex screen. So I think in those circumstances, we'd advise people to err on the side of caution to avoid spreading the infection to others. And hopefully then they would remember that the next time they're behind a screen or wearing PPE, that they would remember to pause the app.
Okay, this question is maybe more for those who are slightly more tech savvy and have been looking through the COVID-19 exposure logs in their phone settings. It's from Stephen. He sent it in and he's asking, why do I frequently see matched keys, yet the app never tells me to isolate? So I suppose, Eddie, to start off with, could you explain what a matched key is for those of us who don't know?
Okay, so we have developed the app using a Google Apple API or their sort of tech platform. So that's something that was developed by Google and Apple to support these contact tracing apps in across all the countries where they're operating. As part of the functionality on the phone, it records when you've been in contact with another app user that's tested positive. But in the app setting and the way that we've designed the app, we only want you to get a notification if that contact was for longer than 15 minutes or longer, and at a distance of 2 meters or less. So the logs that they're referring to record every single exchange of keys that you've had with an infected person, whereas the app only gives you a notification if it's been long enough to put you at risk of infection. And we modeled that on what happens with the manual contact tracing process, just to make sure that it was consistent with that.
So should we be worried if we have a match key count, or if we have a match key count but no isolation notification?
No, because the app would notify you if it was for long enough and close enough to put you at risk of infection. The match keys thing, it just lets you know that the app's working, but you shouldn't read anything into that. I mean, if you pass somebody on the street, you don't want to receive an exposure notification just because your app exchanged a Bluetooth ID in those circumstances, because the risk of you being infected through that passing encounter is negligible. So what you want is that, the app is working as it's designed to work. It's only telling you when it's been a significant risk that contact is close enough for long enough to put you at risk of infection. Otherwise, the app, if we didn't do that, you'd be getting notifications all the time, and then you wouldn't know what to believe.
Okay, talking numbers here, you mentioned there how many downloads there have been in Northern Ireland of the StopCovidNI app. Do we know how many positive tests have been recorded in the app?
Yeah, so there's been over 526,000 people have downloaded the app. In that time period, there have been SMS messages sent out to all people who test positive, and there's been 45,169 of those. Now, we don't know whether you're an app user or not, so we send out SMS messages to everyone. Of those, there have been 8,291 who have been app users who've uploaded that positive diagnosis authorization code, and as a result, that's led to 28,000 people getting a notification. So of those receiving an SMS message, you're talking about 18% roughly have received that and uploaded it. And that sort of is reasonable, considering that there's about 27% of the population have downloaded the app.
Well, you said there's about 20% or 20 in the 20s of the percents of the population that have downloaded it. Is that enough people for it to be an effective tool to fight the virus?
Oh yeah, absolutely. And if you consider it, 28,000 exposure notifications, that's 28,000 people who could have spread the infection to others. So if most of those have taken the advice and self-isolated, that's pretty effective. So for every person who uploads a positive diagnosis, there's roughly 3.4 get an exposure notification, which compares very favorably to the manual process. So, we think it's an effective tool, but you have to take it in context. It's only one tool amongst many. So there's the manual process, there's this digital solution for the contact tracing app or proximity app. You also have the other measures you described, so social distancing, 2 meters, washing your hands, wearing a face mask. You need people to do all of these things to have a cumulative effect. No one single solution on its own is enough.
So in October, there was a version of the app released for young people aged between 11 and 17. How is this different from the main StopCovidNI app, or what were the differences there?
So initially we were concerned when we were releasing the app at the end of July as to how we could bring young people on board safely while also respecting the restrictions around privacy and the Data Protection Act. So we engaged with the Information Commissioner's Office, the Children's Commissioner and the Children's Law Centre to work out how we could meet legal requirements and how we could develop an onboarding process that was appropriate for each age group. We also did a lot of user testing with young people. So rather than grey-haired people like myself sitting around a table thinking that we knew things, we actually asked a range of kids from a range of backgrounds, young people up to the age of 17, what they thought, and we showed them mock-ups of what we were planning to do. And essentially what that did was it helped us to develop an onboarding process that allowed them to give informed consent, allowed them to understand what was involved, and also as well give them appropriate advice about involving a parent or a guardian. So whenever you onboard to the app, it gives you an age-specific logon process that meets your requirements, and then while it's the same app, you get a different experience that's tailored to your specific age group. And it was important, for instance, that we didn't patronize teenagers, but equally for the youngest age group, we didn't want them to be frightened or alarmed. So with that user testing and with that design process, we're confident that we've done a good job to try and make it appropriate for all ages up from 11 upwards.
And do we know how many young people between the ages of 11 and 17 are using the app?
That would be impossible for us to say, because part of how we got acceptance for the app was to protect people's privacy. So we don't have any individual information. We only collect aggregate information at a regional level. So we don't know specifically how many young people, but we did notice that there was an initial jump in the average number of people downloading the app whenever we launched. So it bumped up by about 1,000 to 1,500 a day. So we think that was the impact of younger people taking on the app. So we also know that it's anecdotally, we're hearing from schools about teachers and pupils getting notifications. So we are safely assuming that it's out there and it's being used.
Okay, we'll finish with this one, Eddie. And it's about the future of the app. So, well, what is the future of the StopCovidNI app? We were talking about vaccines earlier. At what point will the app be retired and we stop using it?
I think what we have to be mindful of, as you probably heard from Mary-Louise's segment early on, that the vaccination program is quite an ambitious program. If you're talking about a population of 1.9 million, it probably is going to take about 6 months or slightly more to get enough people vaccinated to get the overall protection for the whole community. We will stop using the app and we will retire it whenever the pandemic is declared officially as being over. But obviously, as people are vaccinated and proven to have immunity, they'll also be instructed to stop using the app. So it'll naturally dwindle to the point where it is then withdrawn. Now, what we have learned from the pandemic is this is an effective intervention. So while we will retire the app and we will ensure that there's no data being collected anymore or retained, we still have the technology and the ability to spin it up. If we had a future pandemic, it would be possible to reactivate the app and set it appropriate to the guidance and evidence at the time. So it's been a really useful learning experience, and it eventually, though, will hopefully become redundant as everybody gets back to a normal life. I think that's something we all wish for.
But just to pick up on something you were saying there, this app is now something that it's obviously been developed now, but it could be used in the future should there ever be a need for it again.
Yes, absolutely. I think it's shown that digital technology can play a very important part in healthcare and health interventions. And in this specific role of the infection control, it's proven a popular tool. I mean, you know, if I'd have said that we'd have got over 526,000 people downloading it at the start, people would have told me that was very ambitious. We were hoping for in excess of 300,000. So it's actually really taken off well. So I think it shows us that it can be effective. The other thing that's been very effective has been the symptom checker app that we introduced as well. There's been a lot of people using that, you know, at times up to 6,000 daily, going through getting information about COVID and checking their symptoms. So I think apps are going to be part of the infrastructure in healthcare going forward. And certainly this has been a really useful learning experience for us.
Well, we will leave it at that. Unfortunately, we're out of time this evening. But thanks, Eddie, for coming on and answering those questions tonight. We really appreciate it. And thanks as well to Mary-Louise for speaking to me earlier. Thanks as well to anyone who got in touch tonight. We didn't have enough time to get back to all of you, but hopefully the questions we've asked tonight will have covered what you were looking to know. Don't forget that you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. That's our last coronavirus catch-up before the holidays, so it's good to end on a day with some positive news. We'll be back in the new year, but until then, stay safe.